Morning.
Good morning, Raquel.
How are you this morning?
I'm fine. Yeah.
Could you tell me your name and your title?
Sure. I'm Marlaine Smith, and I'm the Dean and Helen K. Persson Eminent Scholar at the Christine E. Lynn College of Nursing at Florida Atlantic University.
Great.
Okay. So my nursing work and career. Right now, as you know, I'm the Dean of the College of Nursing, and I've been the Dean since 2011. So at this point in my career, being a Dean kind of is consuming my leadership role here. And so I'm very proud of this college. As you know, we're focused on caring and advancing the science of caring and studying the meaning of caring. Focusing on how the art of caring in practice at our centers, and then living caring day to day in our community. So we have a very diverse student body. I'm very proud of that, and we also have a holistic focus in our program and our curriculum. We're the only actually college of nursing in the country that's endorsed by the American Holistic Nursing Credentialing Center for all 4 of our degree programs. So that holistic focus, that focus on caring, relationship-centered care, person-centered care, permeates our whole curriculum, the research that our faculty are doing, and it's a very unique program that we're developing here. My own career, I began graduated from Duquesne University with my Bachelor of Science in Nursing, my Master of Science in Nursing, and my Master of Public Health was from the University of Pittsburgh, and then I received my PhD from New York University. I began in nursing practice on a medical surgical unit, working there, and then moved into public health nursing, and finally oncology nursing. And it was through oncology nursing that I got really interested in holistic interventions, or what are sometimes called complementary or integrative practices in nursing. And through that interest, I decided that I was going to get my PhD at New York University. I wanted to study where Martha Rogers was, and also Dolores Krieger. I began looking at guided imagery, therapeutic touch, other kinds of touch therapies, and with this study of those kinds of therapies, I wanted to be in a doctoral program that would support that. So I completed my PhD and at New York University. I had various faculty positions. I worked on faculty at Duquesne University, at Penn State University. I was in Pennsylvania at the time, and La Roche College, also in Pittsburgh, and then found my way to University of Colorado. And that's where Gene Watson was as dean at the time that I moved there. And so I took my interest in that unitary perspective that I got at New York University and kind of married that with a caring perspective that I got with from Dr. Watson. And so my work has been my scholarship has been related to actually looking at that whole area of unitary caring, and so it's theory development in that area. Also kind of what's called meta theory, which is kind of looking at the whole area of the discipline of nursing and the theoretical development within the discipline of nursing. So that's one area that I would say is the focus of my scholarship. And then also I am working have had developed a research program on touch therapies and the healing outcomes of touch and various forms of touch. So massage, therapeutic touch, and even simple touch. So the last research study that I did was completed in 2006, and that study was a multi-site clinical trial of massage versus simple touch with persons with advanced cancer who were enrolled in hospices throughout the country. So right now, as dean, as I said, I'm not actively conducting any research, but I'm continuing my scholarship in advancing this area of theory development and meta theory. So I published 3 books. One is with a co-editor, Marlaine Parker. We're on our actually 4th edition that I've worked on, and that's Nursing Theories and Nursing Practice. And another book that I co-edited with Marian Turkel and Zane Wolfe is Caring in Nursing Classics, and that's a compilation of all of the very classic literature on caring in nursing. And then the 3rd book that I finished with Paula Kagan and Peggy Chin is on emancipatory nursing, social justice as praxis. Again, really kind of foundational literature from experts in the area of critical theory and social justice scholarship.
That's awesome. It sounds as if you had everything planned from the beginning.
No, no, this wasn't planned from the beginning. So yeah, this was, I think there's a lot of serendipity in one's career that will lead in certain areas. My interest was sparked when I was an oncology nurse, and I could see that we needed other ways to help people other than medication and kind of conventional treatments. And I know you appreciate that because that's something you're interested in as well.
Yes.
But in that area, I started to look, as I said, in what other ways what other modalities might we use as nurses to bring comfort, to bring quality of life, increase quality of life for those that we're serving in nursing. So that was my question as I was engaged as an oncology nurse. That led me to my interest in research related to touch therapies and the difference that could make. And I studied outcomes like pain, sleep, anxiety, symptom distress, quality of life, and some others as well in the studies that I completed in looking at touch therapy. So that path went on. I always had the question, even from the very beginning, I think when I was in my nursing program, I was asking the question about what's really unique about nursing. What distinguishes us from medicine, for example, from some other disciplines. And so really the theoretical foundation of nursing became very important to me. And so I studied a variety of nursing theories, became an expert in those in what I would call the unitary transformative paradigm, and then began developing my own theoretical perspective that was a synthesis of Rogers' Science of Unitary Human Beings and caring theories, and really looking at caring from the lens of a unitary worldview and understanding that. So it's like the path is, for me, was not planned out. It was kind of being in the moment and seeing what my passion led me to down that path. So it's not like I had it in the beginning, but as I continued down that path, it was, wow, I want to know more about this. Let me study this. Let me ask these questions. So that's what really kind of led me. I think, too, we always have to pay attention to opportunities that are presented to us, because I think that's, while I was interested in, as I said, holistic modalities, complementary or integrative modalities, that was an interest of mine. I was presented with an opportunity when I was at University of Colorado to study the outcomes of massage for people who were hospitalized at the university hospital there. That just came from a request. I happened to be we were at this Center for Human Caring, and the Center for Human Caring offered massage to people who were hospitalized at University Hospital. We had massage therapists on staff there. And so there was an invitation for us to provide that, and I said, why wouldn't we want to study this and evaluate the difference that this is making for the people that we're providing the massage therapy to? So it was just that, it was kind of serendipitous. It was this project, this was a call from University Hospital, and then it was, why not start conducting research? And from that, then that really led to 5 studies that I did on outcomes of massage therapy for persons in various, mostly acute care and hospice, but people who were hospitalized.
That's great. But one of the reasons why I thought it was planned from the beginning, you positioned yourself, you knew what you wanted to study, so you positioned yourself, aligned yourself with the people who could assist you, who you could learn from, and that's why I thought.
That's a good point. Yeah, I guess, I definitely knew where I wanted to be. It's like, so for my doctoral program, I wanted to study at NYU. Martha Rogers was there at the time. Dolores Krieger was there at the time. That was where I wanted to be, and it wasn't an easy journey for me. I lived in Pittsburgh. I had 2 small children, and at that time I went with a group of 3 other nurses we were all pursuing our PhD, and we traveled to New York from Pittsburgh. We commuted there for our coursework. We flew up one day. We went to we had usually 3 classes in a day, and then we flew back and completed our coursework that way. So it was, sometimes we had to stay for periods of time, but we all were working at the time, so it was certainly a challenge, but that's what we wanted. So in that way, you're right. It was something that I was passionate about.
Yes.
I knew that's where I wanted to be, and I went for that. And I would say that made all the difference in my own career, I think. Coming to University of Colorado, being at University of Colorado when Jean Watson was there, a visionary, and what she was doing at University of Colorado, that had a huge impact on my life. Studying with Rosemary Parsi, she was at Duquesne University, one of my first mentors. What a brilliant woman to be around and to be able to learn from. So those were influences that were, as I said, made all the difference in my scholarly journey, and probably in leadership, because I think that as nurse leaders, we're always looking for the role models out there. And those were some of my role models. Margaret Newman as well. I chose to do a sabbatical with her and with Richard Cowling when I was at University of Colorado, and that sabbatical year was very important to me as well. And so learning learning their perspectives, what they were doing theoretically, helped to inform the direction that I took in my own theoretical writing and work. Okay, I'll start out by focusing on the areas of scholarship that I talked about. And let's go to the perspective, maybe first talking about the theoretical work that I've done and the area of meta theory. So what difference does that make to nursing is the question that you're asking. And I think that we need to be clear in nursing about who we are, about the focus of our discipline. And to me, nursing is the study of human health and healing through caring. It's very, very important that we identify this, this uniqueness or distinctiveness that we have as a discipline. And I think I have contributed to that in kind of illuminating that through analysis in my own writing. So I think that's been an important contribution that I'm proud of. I think that we're all, at this stage in healthcare interested in interprofessional practice and of course team science. That's extremely important. But we need to be clear as nurses about what we're bringing to the table as our unique disciplinary contribution to that interprofessional team. Yes. And I think sometimes I see that getting lost as we take on the knowledge and the science of other fields without a clear understanding of nursing and what's that unique contribution of nursing. And so that's been one contribution that I think is important for us. Another one is my own theoretical work in my middle range theory of unitary caring, and I think that really provides a look at the between of the person and nurse and what's really happening in that interaction when we're living, when the nurse is living, caring with another. Yeah. And so and as I said, it is a synthesis of caring within unitary perspectives. So certainly Rogers has informed that and originally informed that, but I think I've expanded that to include Newman as well, Margaret Newman's work, and also reflecting some of Watson's work as I pulled together that middle range theory. So what difference does that theory make? Well, I think certainly in kind of providing a foundation for that relationship-centered care, that a greater understanding of what's happening in that caring relationship, kind of explicating it more fully. So that's another contribution that I feel is important. My research, so if we're looking at my research, and as I said, my research really focused on outcomes of touch therapies, and for the most part with persons with life-threatening illnesses. The last study, as I said, were persons with advanced cancer who were enrolled in hospice care. And so what we learned in that final study, and in the studies that led up to that final study, was that massage did make a difference. Even simple touch makes a difference in outcomes like pain, symptom distress, quality of life. So I think I was motivated to conduct this research originally on massage therapy. As I said, it was serendipitous because I was called to do an evaluation of a massage therapy program at a hospital. But I also observed that we were losing some of the important comfort measures that we used to integrate into our care in nursing. And when I was a nurse many years ago, working on a medical surgical unit, we did AM care and PM care. It was part of our comfort measures for that patient. It was also an opportunity for us to do some really in-depth assessment and really quality time, coming to know that person, coming to know what mattered most to them. All of that happened in those moments where we were providing that intimate personal care, right? So I noticed that was going away, that it was missing. And so one of my questions was, if we provide evidence that it's making a difference in some of the patient outcomes that we care about, then perhaps we would look at this more differently. It's not something frivolous that we can eliminate from nursing care. It's something that's essential for the outcomes that we want to achieve in nursing. So that's really, I think, motivated me to continue to study this area of massage therapy. And I did qualitative work. I did some small studies that were quasi-experimental designs, and then moved to more rigorous clinical trials. And in that process, there was always that evidence that yes, those who received the intervention, the touch intervention, and as I said, the final study was massage and comparing it to what we called simple touch. And even simple touch, these were persons who were, as I said, had advanced cancer, were enrolled in hospice. You wouldn't expect that their pain might be getting better or their symptom distress would be getting better. Even with the intervention of simple touch, over time, we did see improvement. That's something that you wouldn't expect. So it tells me that just touch, is important in nursing care, right? And it's right here, right at the tip of our fingers, that we can use, right, in providing comfort, knowing that it makes a difference. It can make a difference in pain relief. So I think, my work is informing end-of-life care and the kind of end-of-life care we give, and that we don't, we're in the midst of this opioid epidemic. Why not try some of these other complementary therapies along with pain medication that we would give? What difference does that make? Let's remember that we used to give back rubs, for example, as part of nursing care. That's kind of disappearing. And so how do we kind of continue to value and integrate this, knowing that the research, the evidence is there to support it? So that's what I'm hoping for, that policies will change in acute care settings, in long-term care settings, to say, this is important. Let's look at the integration, the intentional integration of something like a back rub or intentional touch. We do what's called instrumental touch a lot with our patients. They receive injections or IVs or dressing changes, but there's not an intentional touch. Oftentimes they're missing that, and that's so important. And I'm not saying touch is for everybody. There are some cultures or persons who would not appreciate that, may not want that. And so it's always within the context of what that patient desires, wants, the preferences, the patient's preferences. However, we do know that, I know from that study that the patients that we had, the persons that we had enrolled in this study, loved it. They loved both the massage, but not only the massage, the simple touch intervention that we did. And another kind of finding from this was that this was something that was easily taught to family members, and they would ask us, can we do that with our the family member that had advanced cancer? Is there a way that we can do this simple touch? And after the study was over, they definitely, some of them continued that, because it was a way for them to connect to their loved one, to do something that provided comfort to their loved one. And so it was something that was surprising, I think, to us, that the family members saw this as something that was they could give,
Okay.
Yeah.
So what I'm getting from you is that your science has taken us away from just doing traditional stuff or traditional practices just because it was always done, or because somebody said we should do it, but taking it to a higher level and showing that there's evidence that this
Yeah,
has
I
an
think
impact.
evidence is always, I think that that this has, it's kind of helped me to provide some evidence that what began to be lost because of the medicalization or the technology of healthcare, we lost these expressions of caring, comfort, compassion that I thought was so important. And so the research that I think I conducted provided some of that evidence that now we can say, this is important not only for the patient experience, but also for quality outcomes that we want to achieve in nursing. So I guess that's the area of policy change that I would like to see impacted by the research that I've conducted. So we're talking about, policy, whether it's in healthcare systems, policies that are related to something like the providing opportunities for complementary therapies. In my case, it was touch therapies, but there are other complementary therapies that have shown benefit. But let's, perhaps healthcare systems, hospitals would examine their policies related to making space for this kind of room for caring, healing modalities to be integrated into patient care.
Yes.
Okay.
One, and it's rolling again.
So Dr. Smith, what advice do you have for the next generation of nurses?
Okay. Well, I think I have three kind of little tidbits of advice that I would give. The first one is to find your passion and pursue that passion in your work. Find the place where you can live your values, and look for that place. You need to have a place where you can pursue what you love to do. There's somebody that said, "What makes your heart sing?" So find out what makes your heart sing. What's your passion, and let's say unabashedly pursue that passion in your life, because then what you're doing will not be work. It'll be your love, and that's what you want to find. And then the next piece of advice I would give is to embrace leadership opportunities. We need the younger generation in nursing now to move into leadership roles, and there will always be calls for that, always be opportunities. So I would say, look for those opportunities, embrace it, find mentors that'll help you grow and will nurture you, and you know, kind of take you on that leadership journey and be there for you to help you to succeed. And then I think the final one is to remember who you are. And I say that because I think we can get lost in nursing. We can be pulled away and begin to do the work of other disciplines. And as I said before, I value interprofessional practice and I value team science, but it's so important that we're aware as nurses that we bring so much added value to healthcare. And we have to celebrate that, and we have to know in ourselves that that is so important. We're the ones that bring that holistic perspective to the interprofessional team. We're the ones that are aware of that person-environment interaction and how that impacts health. For example, we know the social, the economic, the political environment and how that can impact the health and well-being of people. And we have that focus on health, not illness, you know, that well-being, quality of life that we're focused on as nurses. We bring that focus on caring, on compassion, on person-centered care, relationship-centered care. All of that is part of the disciplinary knowledge and perspective that we have uniquely as nurses, and that's often what's missing in healthcare, that very essential element that we have to, you know, say, wait, what about this? Let's look at the, yeah, and we need to continue to value that in ourselves and know that that's our unique contribution, and that we can, and as I said, celebrate it because it is very important.
Yes. Well, it's been great having this conversation with you, and I've learned a lot about your scholarship and your leadership role. And I just want to say thank you for affording me this time
Sure, Raquel.
to conduct this interview.
Thank you for inviting me.
Thank you.
Okay.